Welcome to our 5 on 5. We're pleased to welcome Cindy Mayo, the Chief Executive Officer of Providence Medford Medical Center. Cindy, great to meet you. Thanks so much for coming in.
Nice to meet you, and thanks for inviting me.
Our pleasure. So tell us, before we get into what we're here to talk about today, the Affordable Care Act and healthcare changes, this is the first time our viewers have probably gotten a chance to meet you. Tell us a little about yourself.
So I'm the new Chief Executive for Providence Medford Medical Center. I've been there 7 weeks. It's been an exciting 7 weeks. And come to this area from Providence in Washington State, where I was the CEO at a hospital there. And it's been a wonderful transition. The community is beautiful. The people have been wonderful.
Oh, wonderful
I'm really
that you
happy
get to
be
stay.
here.
It's wonderful you get to stay in the Providence family as well. I'm sure it makes things easier.
Yes, they're a great organization. I'm really happy to be here.
Wonderful. Okay, and obviously it's a very interesting time in regards to healthcare. Next week's a big one. Tell us what Providence is doing in regards to the Affordable Care Act.
So next week, October 1st, is when online, the exchanges and information goes up about how to access affordable health care. And so by background, Providence has been getting ready for this for quite a while, looking at how we take care of our patients. And one of the big focuses of the Affordable Care Act is how we keep patients healthy in the community. And so we've been working with our medical groups to provide care and access to patients on an outpatient basis. The Affordable Care Act also looks at the community health as a whole. We're doing some work in that area you might want to cover a little bit later in this segment. And we're looking at how we manage patients in the hospital and then how we transition patients home. And a good example of the Affordable Care Act is how we take care of the whole patient. And in our medical groups, we're actually using pharmacists in our physician practices and case managers and a behavioral health specialist to help care for the whole patient in a primary care setting. And so one of the goals of the Affordable Care Act is healthier patients, preventative care, and we're looking, have been working on that pretty aggressively prior to the actual law going into effect.
And where does Cover Oregon fit in with the Affordable Care Act? Is it crossover at all here in Oregon?
So Cover Oregon is Oregon's way, and Oregon's been very futuristic and has been very thoughtful about making sure to get coverage for the community. So Cover Oregon is Oregon's way of looking at how do we cover our whole population, provide access to health care. So for example, there's about 16,000 residents in Jackson County who have no coverage at all. And this new plan and Cover Oregon will help them access healthcare coverage. And so Cover Oregon is Oregon's way of helping to roll out the Affordable Care Act in the state of Oregon.
Very good. Okay.
Very thoughtful governor who's worked on this. And Providence has been very active legislatively and throughout the state on how do we transform care in our healthcare markets. So for example, on the coordinated care organizations, those organizations that manage healthcare populations, we serve on the boards of those, and we're actively participating in how to manage care of those patients in a really cost-effective way while providing access to patients to get the care that they need.
Very good. All right, we're going to take a quick break. We'll have much more with Cindy in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Cindy Mayo, the CEO of Providence Medford Medical Center. Cindy, tell us about the Community Health Needs Assessment. What is that?
So that is a process where our organization, Providence, is actively engaging with multiple community constituents. For example, United Way, the school districts, the police departments, the mayors, other organizations in the community that touch the healthcare or are impacted by healthcare of all of the individuals in our community, and assessing what they see are the healthcare needs. What are we missing? What could we do better as healthcare providers, so that we can put together a collaborative approach to how that work gets done. So we know that the hospital cannot provide every single need, nor should it, because there's agencies in the community we can collaborate with to do that. And so that Community Health Needs Assessment will take place for us in October. I'll be going out with my team to meet in the community with individuals and groups to get their feedback on what we need to do to plan for covering the healthcare needs of our community together.
And what do you find, in your opinion, is the biggest advantage to Oregonians with the Affordable Care Act?
I think what's most exciting to me in my background as a nurse is that individuals can get access to health care whether they have pre-existing conditions or not. So individuals who have diabetes or renal disease, kidney disease, or other conditions that they've been uninsurable previously, now will have access to plans that will get them covered, and that's incredible. That's very exciting to me.
Yeah, okay. All right, and lastly, I understand you have some websites. If people have any questions or want to find out more information, you have some websites.
Right, so if you want to look at Cover Oregon, and you can actually model what your costs might be if you want coverage. That's www.coveroregon.com. And then Providence Health Plan also has a website that we have Cover Oregon. We are covering patients in communities as well. And that website to research is www.providencehealthplan.com/reform. And so you could look at the Providence plans as well. And again, the goal of Providence in all of our communities is that our patients in our communities have access to health care and there's coverage for them to access that care.
Very good. Cindy, great to meet you. Thank you so much
Pleasure.
for coming in.
Thank
Appreciate
you.
it. Stay with us. We'll be right back.